Hi, my name is Kweku. I am a pharmacist. In today's video, I'm going to be talking about cholesterol-lowering medications, statins. We're going to be taking a look at 5 key ways by which you can minimize or prevent arguably the number one most common side effect of statins, which is muscular pain. And the first one is drug and food interactions. This is because certain medications and certain foods affect the way statins or other medications are excreted or metabolized from the body. So when you take a medication, there are certain enzymes that are supposed to break down that medication and make sure that that medication leaves your body in a timely manner. This prevents the levels of the medication from accumulating in your body to dangerous levels. Now, it turns out that there are some medications that inhibit or prevent the enzyme that breaks down statins from having its full effect. So when this happens, you have a statin buildup in your body that tends to cause these adverse effects, especially muscular pain. But the first class of medications is other cholesterol or triglyceride lowering agents or medications. Now, this is ironic because a lot of the times when somebody has high cholesterol and needs a statin, 9 times out of 10 or a significant number of the time, they also have high triglycerides. But it turns out that medications used to lower triglycerides, so for example, gemfibrozil and fenofibrate, also affect the way statins are excreted from the body, and therefore it increases the risk of developing such muscular pain. Now, this is not to say that these medication combos cannot be ever taken together, because in reality we dispense several thousands of prescriptions of these combos. The only thing is that it increases the risks. And so if you are supposed to take both classes of medications concurrently, typically a dose adjustment, especially of the statin, should be made. So for example, if you're taking gemfibrozil, it is recommended that your highest dose of rosuvastatin that you should take is 10 milligrams. The next group of medications are calcium channel blockers, particularly diltiazem and verapamil. Similarly, when you have to take both classes of medications concurrently, a dose adjustment to the statin should be made. For example, diltiazem and simvastatin, when combined, you should keep the simvastatin dose at a max of 10 milligrams. Now, talking of calcium channel blockers, one of the most popular calcium channel blockers is amlodipine. Now, while amlodipine can have a similar effect, it is not as pronounced as the diltiazem and the verapamil. So I do see a lot more people taking amlodipine and statins versus diltiazem or verapamil and a statin. The next class of medications that may affect statins are what we call antiarrhythmic medications, and these are usually used to treat heart rhythm problems. So I can think of amiodarone and digoxin. So if you happen to be on these medications, you want to be careful if you're taking a statin as well. The next group of medications are antibiotics, particularly a class called macrolide antibiotics. And these can be easily identified by the way they end. They all end in mycin. Typical examples are azithromycin and clarithromycin, erythromycin. So these are also notorious for increasing the concentrations of statins in the body and make people more prone to develop such muscular aches. Typically, I've seen instances where if patients or if people have to go on these two medications concurrently, I've seen doctors tell patients to hold off the statin for the number of days, usually about 7 to 10 days, while they take their macrolide antibiotic till they are done with the antibiotic, and then they resume their statin therapy. But of course, everybody is different, so make sure you talk to your individual doctor for guidelines as to what to do in those circumstances. The next group of medications are antifungals. We call them azole antifungals. Typical examples in that group include ketoconazole and fluconazole. The last one on the interaction list is grapefruit and grapefruit juice. As most people are already aware, grapefruit and grapefruit juice inhibit the same enzyme that breaks down these statins. So taking grapefruit juice and grapefruit concurrently with statins increases the risk of you developing such muscular pain. Now, the next tip to consider to combat statin-induced muscular pain is to switch to a different statin. Now, there are two main statins. One is more likely to cause these muscular pains than the other. We have the lipophilic statins and the hydrophilic statins. Now, the lipophilic just means, if I break the word down, lipo means fat or lipid, and then philic means like or loving. And then we take hydrophilic, we have hydro, it's water loving. So the two types of statins, one of them is more likely to cross into the muscle to cause these muscular aches and damage. And those are the lipophilic statins. That means that usually for something or a chemical to cross into the cell or the muscle, it must be fat loving, or it must be able to cross a fat barrier. Now think about it this way. You cannot easily mix water and oil. So you have a situation where the lipid or the fat loving statin is able to cross that fat membrane of the cell and go into the cell and cause more damage, relative to the hydrophilic, which are water loving, and therefore they don't easily cross into the cell to cause damage. The two most popular lipophilic statins, which are most likely to cause muscular aches, are atorvastatin, marketed under the brand name Lipitor, and simvastatin, marketed under the brand name Zocor. On the flip side, for the hydrophilic statins, the two most popular ones are rosuvastatin, marketed under the brand name Crestor, and pravastatin, marketed under the brand name Pravachor. So rosuvastatin and pravastatin theoretically are less likely to cause such muscular aches and pain. The next step is to take a lower dose of a statin. Now, these muscular pains that are caused by statins tend to be dose dependent. That means that the higher the dose, the greater the probability that you're going to experience these muscular aches. So theoretically, you can start with a very low dose of a hydrophilic statin. So for example, I can think of starting on as low a dose as Crestor or rosuvastatin, say maybe 2.5 milligrams. I know even some people who would take it just about 1 day a week, and then gradually the doctor would increase it to maybe 2 or 3 times a week, and then if they're able to tolerate it, increase to about 5 milligrams a week. A lot of people are able to tolerate the statins that way if you kind of gradually build them up to the desired dose. For some people, they may never get to the desired dose, but the doctor wants them actually to still be on a statin. So 2.5 milligrams every day is better than nothing at all if you are in that category that you actually need a statin to protect your heart or to reduce your cholesterol if you are a very high risk patient. The next step is to consider taking supplements. Studies show that people who are low in vitamin D or who have low levels of vitamin D are more likely to experience these muscle cramping and muscular pain associated with statins. So you can do a simple blood test, and if you find that you're low in vitamin D, you and your doctor can discuss a vitamin D supplement would not be a bad idea. Also, there's another supplement, CoQ10, which I'm kind of working on a video. I'm going to link it in the description once that video is done, which can also be taken. And a lot of people say that it alleviates some of these pains and some of these muscular aches that are associated with statins. So 2 vitamins, vitamin D and coenzyme Q10, are recommended if you take statins and you experience muscular pain. The next step is to try a non-statin option. If you've tried all these strategies that I've mentioned and you're still not having any success and your doctor still wants you on a cholesterol lowering medication, there are other options that you can try. So for example, I can think of a medication called ezetimibe, marketed under the brand name Zetia. Studies show that it's able to reduce LDL cholesterol by as much as 15%. So that is a consideration that you can also think about. The other option is to discuss with your doctor if it's appropriate for you to try this newer generation of cholesterol lowering medications. We call them PCSK9 inhibitors. A typical example in that group include Repatha and Praluent. Those are able to lower LDL cholesterol to the barest minimum without even a single complaint of muscular aches. Only problem is that these medications tend to be very expensive, and a lot of insurance companies, at least if you're in the United States, people have trouble getting those medications approved through their insurance. So the downside with those medications is cost and getting your insurance company to cover them. So high level overview of some strategies you can take to minimize statin-induced muscular pain. On your screen now are other videos that I did about statins. I think you'll find them interesting. Thank you for staying through. Stay blessed, and I'll catch you on the next video.